Chairman Tuberville, Ranking Member Warren, and members of the subcommittee. Thank you for the opportunity to testify before you today. My name is Dr. Micah Lansford. I'm a pharmacist and owner of Roden Smith Pharmacy in Clovis, New Mexico, and sits next to Cannon Air Force Base. It's a community of active duty members, their dependents, and retirees, and we've been able to serve this community for as long as I can remember. We did, anyways, up until 2023, when Express Scripts forced us out of the TRICARE program. For years, TRICARE beneficiaries could choose the pharmacy that served them best. For most, that was a community pharmacy like mine that provides a higher level of personal care, easier access, same-day medications, packaging, MedSync, immunizations, delivery, compounding, and a pharmacist that knew their family and their situation. Now, many pharmacies like mine have been forced out of the TRICARE program. We were pushed out by contract terms that made an already difficult participation impossible, leaving beneficiaries with fewer choices and less access to the care that worked best for them. I reviewed all of the almost 7,000 prescriptions we filled in 2022, our last year in the program, and we were reimbursed on average 37 cents below the cost of the drug itself, without any additional allowance for overhead. After ESI was awarded the T-Pharm 5 contract, they drastically reduced their reimbursement rates, such that I would have lost almost $9 on every prescription I filled before overhead, before any other expense. That would have been catastrophic for our business's viability and for all the other patients that we serve. Prescription care should not be a loss leader. No pharmacy can continue serving patients under a contract that requires it to lose money on the very care that it provides. ESI's contract had real-life consequences and was felt acutely by the families who live and depend on our care locally. People like Lynn, a disabled retired airman, and Jelaine, his wife, and also his full-time caregiver. Before each monthly fill, I worked with Jelaine to reconcile changes, identify concerns, and ensure his medications still made sense. I can't take care of them anymore. Like the many military spouses holding down the fort at home while their airman is deployed abroad. They used to be able to come through the pharmacy drive-thru or pop in for an antibiotic for a child. Now they have to wade through security lines trying to get on base pharmacy, hoping the drug is in stock when they arrive. Or all the elderly retirees that used to be able to come in, dump their problems or confusion quite literally on the counter in front of me, in front of somebody they knew and trusted. I can't do that for them anymore. And it wasn't just the patients that suffered under this contract change. I had to look each of them in the eye and say, I am sorry, I can no longer help you. Mail order may deliver medication. Community pharmacy is where care is delivered. These stories were not inevitable. They were the purposeful result of network terms ESI chose to impose and the conflicts of interest inherent in the system. ESI decides which pharmacies can participate, how much they will be paid, and then profits when the patient is redirected to one of their mail order or specialty pharmacy facilities. Then ESI supplies most of the data to judge whether or not the network is adequate or if they are successful. No contractor should be allowed to referee a game while also competing in it. Military families experience the consequences while the contractor reports that the system is working just fine. Congress can and should correct this, require an independent audit, measure real pharmacy access, require transparent and sustainable reimbursement, protect patient choice, and establish conflict of interest safeguards that require a non-vertically integrated manager. The question is not what pharmacy or what military families can tolerate, it's what they deserve. Thank you.
Thank you. Mr. Raybould.
Thank you, Chairman Tuberville, Ranking Member Warren, and distinguished members of the committee. My name is Greg Reimbuld. My name is Greg Reibold, and I'm with American Pharmacy Cooperative, consisting of approximately 1,500 independent pharmacies throughout this country. Grateful for the opportunity to speak. More grateful that Dr. Lansford here had the opportunity to share his experience, which matches the experience of thousands and thousands of independent pharmacies across the state. I would lead with this. I would posit that what Express Scripts did in the TRICARE retail network is the poster child for while PBM should not be allowed to own pharmacies, mail-order pharmacies or retail pharmacies. It speaks to the problems of vertical integration. Now, here's the thing. The law is complicated. Under current law, TRICARE, federal law, absolutely favors mail-order pharmacies. It's entrenched. It restricts retail pharmacies from filling certain brand-name maintenance medications, and it, in the statute, penalizes beneficiaries for choosing retail via higher cost sharing on paper. And every chance Express Scripts gets, every chance they get, they love to tout the savings of mail-order pharmacy. But here's the thing. Under DHA's own data, it turns out that despite the federal code, over and over and over again, it's cheaper for a TRICARE family, for a TRICARE beneficiary to fill a prescription at a retail pharmacy than it actually is at ESI's mail-order pharmacy. It's cheaper on those cost shares. Stunningly, filling a generic medication at a retail pharmacy in TRICARE not only is cheaper for the beneficiaries via lower cost sharing, it's cheaper for the agency itself. According to their own reports, year over year over year, generic medications on average are cheaper at retail pharmacies than at Express Scripts mail-order pharmacy. In 2018, they were cheaper by 85% on average for a 30-day generic medication. And so what happens? Why on earth would Express Scripts in around 2022 want to cull between 13 and 15,000 retail pharmacies from their network under the auspices of cost saving? I would posit, and if you're anything like me, and I know I am, I would posit that you look at their self-interest, you look at the vertical integration, and DHA's own data shows that between 2018 and 2022, ESI's mail-order pharmacy in the TRICARE network lost about 9% of utilization. 9% of utilization. Beneficiaries were choosing retail pharmacies to get the care that they deserve. And so what does Express Scripts, the PBM, do? They cull around 13,000 retail pharmacies from their network, right? I think the GAO figure was around potentially 380 beneficiaries that lost access to their pharmacy of choice. But you know who wins? Express Scripts mail-order pharmacy, the pharmacy owned by Express Scripts. That's the only winner here. The only winner here. And I want to talk a little bit more